particularly worried about young children. And for any of you, no matter what your field, no matter what your occupation, you know someone who has young children that's trying to understand how to take care of their family and raise their children. So let's jump right in and get started. So Ken, you wrote recently that how we treat our society's most vulnerable members, our young kids, and especially those in low-income households, defines who we are as a nation. It's a moral issue as well as an economic one and a gender equity issue. What does the latest research, some of which we've been talking about this morning, tell us about the potential for early childhood education to narrow the academic gaps for young children entering elementary school from divergent economic backgrounds?
Well, thank you. I think the research continues to deliver the message with resounding clarity that investing intensively at the earliest ages, the birth to 3 timeframe in particular, has enormous impact across the life of a child. It's the right thing to do. It's obviously important for parents who are trying to enter the workforce, but the evidence continues to prove the point. And we've for years have relied on the studies from the Abecedarian Project, the Perry Preschool Project, evaluations done in the 1970s. And you were nice to quote me in that essay. I was reflecting on a new study that was just accomplished in Tulsa that followed all the way to 3rd grade, 75 kids who participated in a very high-quality program called Childcare, which we learned about in Omaha, Nebraska from the Buffett Foundation, and brought to Tulsa. But they followed these kids all the way to 3rd grade. And if you, as you well know, the critics of investing early always talk about the fade effect. These gains fade. But we saw that watching these kids, monitoring them all the way to 3rd grade, better vocabulary, better math, better behavioral outcomes that persisted across a long period of time. So it's just more evidence that the payoff of investing in those young ages is really unquestionable.
Absolutely. So Patrice, the holding company is dedicated to seizing the opportunity to care from a design perspective. So what is the opportunity as you see it to impact early childhood?
Yes, thank you so much for that question. Yes, so we at the Holding Co. look at how do we bring better solutions to caregiving across the board. So we see the full spectrum of the care economy, from caring for kids, to caring for the aging, to the intersection with healthcare, to family life. And really our work comes from the premise that we do not have a modern care system. And childcare is a huge example of that failure. This is a broken system. And so much of this really stems from the fact that we don't see care as something that we should be putting like investment towards, that we should be innovating in, that this is something that deserves our public attention. Much of our history with care is that this is a private issue. This is something for a family to solve. So much of this is about the perspective that this is women's work. Like, this work has been disproportionately carried by women. It's disproportionately carried by women of color. And therefore, when we look at this, it's unpaid labor, or it's very underpaid labor, that is essentially underpinning all of our care systems. So our work is to really say it is time that we actually give the care economy the attention, the respect, the investment that it deserves across the board. And so we have the great privilege to be able to work with innovators across all sectors, from those in government to those in corporations, to startups, to nonprofits, who all have a huge role to play in saying, let's actually get families the system that they deserve so we can all have the time, space, and maybe some joy that we actually deserve. So in childcare, we've had the privilege to work with a couple of interesting organizations. One in particular that I want to bring to this conversation is ECIC, which is the Early Childhood Investment Corporation in Michigan, which is a public-private partnership that is all about how do you improve childcare in that state. In Michigan, 44% of that state is experiencing childcare deserts. That means there is no access to licensed providers, which is just a phenomenal crisis when we think about that from the perspective of our kids, but also from the perspective of their parents. Like when we think about the stress that we are putting on families in that they do not have a guaranteed ability to re-enter the workforce. There is a woman that we talked to in that work who, she was a pretty organized person. This was not her first pregnancy. She found out she was pregnant with twins. At 3 months, she immediately put her name on a daycare wait list. She then got her twins into daycare when they were 6 months old, that period of time, and in the meantime had to kind of basically borrow favors from her sister-in-law and her dad to cobble together a solution. And we're doing this in a country in which 1 out of 4 women goes back to work 2 weeks after having a baby.
Absolutely.
So Dr. Beal was on stage just before. You're talking about the immense stress, that we are putting on families. So what they've done in the state of Michigan with ECIC is to say, let's bring together some unique players to this party. Let's not just let's kind of open up who we bring into this conversation and take as much of a systems view as we can. And so they have said, let's look at this as a workforce issue.
Right.
Because one of the key problems that exists is not actually being able to bring anybody, if there are no providers, you can't actually do this work. Excuse me. Yeah.
Right.
Yeah.
So we talked about innovation. We talked about investment. Now let's talk about industry a little bit and history. And you lead Martha's Table. And one of the most prominent healthcare programs and Head Start programs as part of that. Talk about that a little bit. Talk about the importance of the work you're doing through Head Start.
Absolutely. Thank you for that. And so I want to start, as I prepare to answer that, I want to talk a little bit about how we see early education. Because I think part of the challenge that we're having is we see it as just care, when in fact it's actually the most important time in a human's development. And so when we talk about how do you structure and create high quality education programs for young children, then I think we have to begin with that premise. Because so long as we see it as, oh, we're just taking care of this baby, then you miss actually what is happening in classrooms all around our country with women who are underpaid, undervalued, underrespected. And yet we entrust our children to those individuals to help shape and form our children and their well-being. For us specifically at Martha's Table, we have been committed for a very long time to strong children, strong families, and strong communities. And so when we think about the well-being of a child, we do it in the context of a whole child, whole family approach. Because if we only focus on the well-being of the child, but we're not sensitive to the needs and the plights of parents, then we will miss the mark, right? So this is how I explain it. Strong children are strong because they're in strong families. Strong families are strong because they're in strong communities. And so when we create the bridges between those, we create the opportunity to see our children and our families thrive. Specifically at Martha's Table, we've operated early childhood education programs for the majority of our existence, more than 40 years. And during that time, we've learned a lot. We started out as a daycare model that really was focused on making sure children were loved and well cared for, and they were fed and they were happy. But many years ago, we weren't really focused on actually what needed to happen to help young children succeed, and what tools and opportunities we needed to provide for parents so that they could be best suited to support their children, understanding that a parent is actually their child's first and best teacher. And so with that being said, we transformed the education programs that we have. We started to focus not just on making sure children were well cared for and loved, that they had the materials that were needed, but that we actually had teachers who were well equipped and trained to support their educational needs, not just their basic care needs. And so that led us to really shift the way that we supported teachers and going back to school and acquiring the credentials that are necessary to be able to effectively understand child development and support children in their learning. And I always say to people, you know, you would never go to a doctor who's not properly trained. You walked into a doctor's office and they said, well, you know, I didn't really go to medical school, but I always liked the human body and I just like people. That would be ridiculous. And yet in early education, we think it's okay to have our children in environments with teachers who aren't properly trained and equipped. And so that was one of our commitments. Make sure that our teachers, even those who've been working with children for years, how do we make sure that you're properly equipped, properly trained? How do we actually pay teachers at market rate plus? That was something that as an organization we did. We looked at the landscape of education in DC and said, what does the average early child educator make and earn? And we're going to take that amount and then add 20% onto it to ensure that we can decrease the likelihood that many of our teachers are in the same situation that, to be quite honest, many of our families are in. Invested heavily in training and professional development for teachers. And then we actually said, you know, our children are situated, they're in great classrooms, well-resourced classrooms, our teachers are getting the support that they need, and we want to make sure that we are supporting families. And so we asked parents, what do you need? What is going to help you and your family thrive? We didn't assume that we knew what was best for families. We asked. And they shared with us, I need to know more about how my child is developing. I need to know, how do I connect to other community resources? I'm interested in going back to school and expanding the reach of my family financially. And so Martha's Table as an organization, we've embraced those things. We have an amazing parent policy council that allows us to actually center the voices of our families. And I think recentering power is really important so that we're not actually dictating to families what they should do and how they should do it, but we're listening to families and we're being responsive to our families and saying, how can we come alongside you and support you so that you and your children can thrive?
It's all so critically important. I was privileged to be the head of school at a school that was started in 1939. Sponsored by Anna Freud and Erik Erikson. And when you think about Erikson's principles about early childhood education and those first 5 years being the most important developmental phase in a child's life, in a human's life, we understand the critical need for programs and policies and support for early childhood in particular. An early start and the Head Start program. Our school was the first Head Start license granted in the United States. And so that long history of childcare is a part of our country, but somewhere along the way, we stopped providing and we stopped developing that industry. Talk to us a little bit about that, Ken.
Well, and I want to thank you for your remarks about Martha's Table. It really is a light in the nation and an inspiration to our work also. In Tulsa. I mean, it's, as I listen to your question, I mean, it is really criminal how little we invest in the earliest years. And it's actually, really it's across every segment of society that underinvests in those years. Obviously, the federal government is very generous with our older Americans, Medicare, Social Security. Our state governments deeply support our institutions of higher education. Even philanthropy mostly ignores these earliest years. You don't see a lot of people putting their, not that they should put their names on early childhood centers, but I mean, that's not what turns most philanthropists and corporations on. And so we really have to continue to make this basic case about the moral and economic purposes of these earliest years. You know, and the other point here is that to do it well is extremely expensive. Your point. I mean, it is not just warehousing of children that makes the difference. These programs that have shown the results over decades are very high quality. So Childcare, for example, we're spending as much as $30,000 per child per year, if not more. And the funding that comes from early Head Start in the federal government is 50, 60% of that cost. And the complexity that these people the leaders have to engage with to braid the funds is just enormous. So I just think we've got a lot of work to do. Early Head Start and Head Start, it's got a whopping budget of about $12 billion per year. I mean, that's a minuscule federal budget. And the early Head Start part of Head Start is a quarter of that money. And it's more expensive to teach the younger children. And it's much more under-enrolled than Head Start is. So I think we really do need to place more at the center of the national conversation. And I love the earned income tax credit and the tax credits that Michael Bennett and others have worked on. I cheer those on and want those to continue. But basic early childhood center-based education also needs a great amount of renewed focus and intensity.
And we need to think about the professionalism of the staff, as you've all said. We need a generation of people who are professionals and well-trained to work with our youth, to understand developmental theory, and to understand what's good for children is good for society, especially our youngest members. What are you thinking are the next steps as we begin that process?
Well, I think it's such a great point to put emphasis on the provider experience. We've had the opportunity to talk with providers, especially in our work in Michigan, but also in work we've done in Houston, and you hear time and time again providers talk about the fact that they do this work because their families need them, they have nowhere else to turn, they would never turn a family away, but they can't afford to pay themselves. Like, we had a provider talk to us, she runs a center, she has staff, she says, after I'm able to pay my staff, I look across the hours that I've worked, 50 to 60 hours this week, I'm averaging $9 an hour. That is not a sustainable system for anyone, and that's what our childcare system is really built on. It's built on the care and almost the martyrdom of the staff that's out there that is committed to making sure that families have a place to go. But that's not a working system. And so it's so crucial that we actually, you spoke to this kind of situate childcare in a workforce issue. Like, how do we make sure that these are desirable jobs, that these are jobs that people go to and people stay in? Like, when we look at it from the perspective of a child, like, you need retention. You need that same person to be there, month after month to really grow that child and turn on that brain. And we are not creating the situations in which we are really supporting our workforce around the way in which they can show up. So that was one of the things that we were quite excited about with our work with ECIC in Michigan, is really a focus on apprenticeships and paid apprenticeships. So how do we actually get new talent into these roles and do it in a way in which they're supported and can actually be retained? So it's just thinking about ways in which we can do this, and they're now able to do that in 42 counties across Michigan. So it's that's a smaller thing that we can do for the field, but it's actually so critical when we think about this as an underlying system that we need to change.
At Martha's Table, you've engaged with very important partners in your work at the university level. Would you tell us a little bit about that? Because those partnerships have proved to be very important in many ways.
Absolutely. And so we were fortunate to receive a very generous grant from JP Morgan Chase that was going to really focus on Black and Latino women in the space of early childhood education. And as a result of receiving that funding, Martha's Table, American University, Trinity Washington University, and organization Lift DC, and we also partner with Urban Institute to do the evaluation piece. We came together to say, what would it look like if we intentionally invested in increasing the academic credentials of the early childhood workforce in DC, and we provided all of the wraparound supports that, to be quite honest, are needed in order for them to succeed. So it's one thing to say, yes, we'll pay for you to go back to school at no cost. In our particular case, we were actually to create something that you don't also often hear in universities. We had articulation agreements between both universities. So you could actually go to American University to get your CDA. You could then transfer to Trinity Washington University to receive your AA, and then you could choose to go to either AU or to Trinity to actually receive your BA or your master's. And so at the same cost as the more reasonably priced Trinity Washington University, because there is a great difference in the amount that one costs versus the other. And in addition to your educational opportunities, we were going to make sure that if you needed access to clothing for you or your child, if you needed access to healthy groceries, we would provide that. If you needed access to transportation or to childcare or to anything else, mental health and emotional wellness supports, anything that that educator was going to need as they were going through the process of improving their educational outcomes, that we would support. And as a result of that, we've been able to support almost 200 women in the last 2 years as they have pursued this opportunity. What that does is not only supports the families, but it actually ensures that we have a more appropriate workforce who's well-equipped, well-trained, and people who love children. And so I love children, I'm properly equipped, and I'm properly compensated for the work that I do. And that's been really important to us, to make sure that we're getting women into environments that are going to not only support them as professionals, but actually make sure that they earn a family-sustaining wage.
I think it's going to be critically important that we message very differently around early childhood education and childcare in particular. As we see more women going into college, going into graduate school, entering the corporate workforce, huge numbers are needing childcare, whether they can afford it or not. But affordable childcare is at a premium in this country. And so it's going to become, we need the innovation, the industry, and the creative thinking to think how we can turn for childcare to some of the corporations as a benefit of the workforce, and thinking in different ways about childcare. As you look across the landscape, what are you seeing out there that's giving you hope about what can be done and how we can identify different groups of individuals to become childcare educators and providers in our society?
Would you like to start with me?
Sure.
So I will say this. I mentioned the investment from JP Morgan Chase. That was significant for us. It was significant for the DC region because what JP Morgan Chase was saying is that we believe that there is a necessity to support the early childhood education workforce, understanding who that labor force is and how to make sure that they are properly supported as they actually serve as the underpinning for all of the other opportunities that everyone who has children and has to actually access childcare has. And so making sure that that investment was there was extremely important. I will say that in the District of Columbia, I am very excited because DC has adopted what's called pay equity, a pay equity fund. And in DC right now, I'm a little nervous because I hope the funding maintains. All of these major cities, their budgets are really struggling right now. But as it exists right now, what was implemented this year in the District of Columbia, Pay Equity Fund now has early child educators earning the same amount of money as those that are entering into the early years in DC public schools. Now, in fairness, there is a disparity because in a public school, you actually work 10 months out of the year, plus all of your vacation time. So it's not quite the same as all day, all year. However, when you think about the average early child education worker in DC was averaging about $17,000 to $24,000 per year. And now if that same teacher has even a CDA credential, their salary is now going to be at $45. And the minute you have an AA, it goes to $54. If you're a bachelor's degree teacher, it's now at $75. That is a game changer for the education workforce.
Absolutely. Absolutely. Kim.
Well, I'll echo one of the insights there, and maybe it's less the upside, but the downside of a similar phenomenon we're seeing in Oklahoma. The cause for joy in Oklahoma over the last 10 years, they're not that many, but one was a significant increase in teacher pay. in the pre-K to 12 system, and many years of battling for those raises, a walkout, and march to Oklahoma City Capitol, and now about 40% increase in teacher pay. But that doesn't redound to the childcare industry or those working in our early childhood centers. So it has become increasingly difficult as a workforce issue to hire and retain early childhood workers who are being begged to go to the pre-K system at 50% higher wages. So I think that is one of the more insidious effects of pre-K across the country, and more states doing pre-K, is that it's probably put some additional pressure on the early childhood system. So I think that's another reason to kind of really lean into this problem. One other quick point. This is the issue of how I think present and compelling the issue of childcare is in our politics these days. So I come from Oklahoma to California, from the reddest state to the bluest state. But you talk to our politicians, they will tell you that there are two issues on their voters' minds when they're knocking on doors: prices going up at the grocery store and childcare. And those two things are, as our legislators go into the session, very much on everybody's mind. So we've got to really leverage this, and whether you're in a liberal or conservative state, I think that pocketbook issue is really at the forefront.
Patrice, what do you see as a compelling issue and a story that you could tell to convince people about the importance of early child care?
Yeah. I was going to also add on to these two fantastic points. Like,
Please.
one of the things that we've seen that we're excited by from the state of Kentucky is actually work that they've done to make child care free and accessible to all providers in that state as a benefit, as a way to increase provider retention, which is, I think, a pretty innovative way to look at that problem. When it may be very difficult to raise wages, what are some of the other ways in which we can truly strengthen the system? So I was excited to see that. In terms of the story that we see around wild childcare is just so essential. I mean, one of the things that is a bit heartbreaking that I think will resonate with this room is we see the impact on teenage children, older children in families who, when there is no childcare, they become the childcare solution. Okay, and they are pulled back from all of the enrichment support. We look at the mental health crisis. We look at loneliness. We look at what these kids we want them to be engaged and active in their community, and they're the ones in a large part who end up holding the burden of then what we are not delivering for our families. And that in and of itself is a huge call to action to say this is just this isn't what we want as this country. We want everyone to be able to work, to thrive, to participate. And in order to do that, childcare is the essential infrastructure that we need for that to be true.
And I think we have to talk to the people, not only in government, but on our boards, in our companies, about the need for affordable childcare. I'll tell you a funny story. I wanted childcare for our teachers in school. To be able to start. Our nursery school program started at 2, but what do you do from birth to 2? And so I talked to the board for a number of years, and then there was a year, about 18 years ago, when 9 of my very best young teachers were all pregnant at the same time. Hello. And they were the favorite teachers of the parents in school. And I went to the board and I said, our experience is these young teachers who are at the beginning of the salary scale are going to stay home with their first child rather than coming back to work. Perhaps we can add to their longevity on our faculty if we provide childcare. They voted unanimously to fund childcare, affordable childcare, not only for teachers, but for every employee in the school. And it made a huge difference because all of a sudden it was diverse, It was practical, it was important, it was essential, and the working mothers in the school financially supported it too, because they saw that as a model for something that they wish was happening in their businesses. So let's talk some more about those innovations that you see out there today that could be really critical in moving the conversation forward on a national level in red and blue states.
So I'll start. So I actually have lived experience. So I have 2 adult sons now, but as a young mom, was a special education teacher, found out that I'm, of course, pregnant with my first son, and I did not want to leave the classroom, right? I knew that I would need to take off a certain amount of time so I could heal and certainly develop an attachment with my baby. But my school provided that. And so literally, by the time I had my second son, my classroom was here. My youngest son, his classroom was right next door to mine here. And my other son, his classroom was right to my left. And so I never missed the opportunity not only to come back to work and work with the children that I loved, but I actually had the opportunity to be connected to my children and their educational experience. It was the best of all worlds. And so I know how important it is in early childhood environments or any school environment to make that resource available to the people who are dedicating themselves to supporting the well-being and the education of young children. So I lived that, and it made a huge difference. I share with you, my son lives in San Francisco, so I got a chance to see with him yesterday. That's a sidebar. But I say that to say that that way of thinking about not only just the children, but the workforce holistically matters. And so whether it's innovations such as having on-site childcare, providing transportation supports to the workforce, I think is actually something that we're seeing more support for. And understanding, to be quite honest, that teachers are human beings too. And so providing opportunities for paid time off so that teachers can actually take care of their own family's needs are some of the innovations that we're seeing without a lot of strings attached.
And for even parents who, or people in the workforce who aren't parents, to develop that understanding and empathy and shared support and cooperation for their colleagues who are parents, to begin to be more humane about what childcare means and quality childcare. What else can we think about that would be innovative, that would be inventive, that would be exploratory in the nature of childcare that we could replicate easily?
Well, I have one other thing to add. I'm not sure
Please.
it's going to rise to the challenge of as innovative and exploratory as you're challenging us to be. But there is one unsung program that the Obama administration launched, which I think really unlocked a lot of opportunity for us in Tulsa, and that's the Early Head Start Child Care Partnership Initiative, which uses the Early Head Start grantees by making an additional grant to those grantees to then work with the larger child care industry in their communities by making grants to improve their physical facilities and to offer training and professional development to other actors in the industry. And as we discussed, it's a very tough industry to survive in, as you well know. So in Tulsa, we have been able to add on to that grant from the federal government with private funds, and our Early Head Start grantee is working with about 100 providers throughout all areas of our city, some of the most impoverished areas, to improve the facility and to build bonds of partnership and development and collaboration, which I think have been really helpful. In fact, when we launched Childcare in Tulsa, with very high quality couple centers, at first we had a lot of resistance from folks in the industry. What do you mean? Why don't, how about us? Why aren't you investing in our centers? And there was a tension that existed in the early years. I think this particular initiative has done wonders of building a more collaborative culture across our child care industry in Tulsa. So that particular Obama-era program needs to be recognized and embraced and built upon.
Absolutely.
I'll share 2 examples. One is we've been lucky to partner with technology startup called Bridgecare, and there are others like Bridgecare that are all about building the missing technology infrastructure in childcare. And I think this is a really important role in where tech can play, can bring some real serious know-how and good partnered with government to be able to then deliver something that we all know is missing. Anyone who's interacted with the childcare system, you're feel like you're going back in time in some cases. It's faxes, it's paper, it's a voicemail you missed, it's timestamps, and so how can we actually look at the way in which we just create the data and the technology system for our government agencies, our providers, our families to have better and more seamless access to information. And when that happens, actually governments can better see, where are we missing enrollment? Where might there be deserts that we didn't know there were? So we're really excited about work like that. I will say, on the other end of the spectrum, speaking to kind of municipal engagement, something that we've seen that's pretty simple that they've been able to do in Michigan by bringing together cities and disparate players is to say there are some basic barriers like zoning that is limiting our childcare growth. Right. When people cannot open centers easily in their homes, we are it's leaving some table stakes stuff off of making progress on this issue. So if you actually what they were able to do is just kind of open up and get rid of those bureaucratic barriers. When we're talking about our childcare providers, they may not be municipal code ninjas or the folks who are just great at just navigating bureaucracy, right? And so those are things that we can, when we look at a city and a county level, say, okay, are there things like that that are actually blocking our child care from being successful or growing that we can just get out of the way?
Mm-hmm.
I would just add one other thing. In the district, when we talk about partnerships, there is an entity called the Under 3 DC Coalition. And it's brought together business and philanthropy and nonprofits and education itself and parents, all of the stakeholders that you think about when childcare comes to mind. And that group has collectively come together to address the real day-to-day needs, but also to engage for advocacy with the government and business and philanthropy, so that it's not looking at it in one slice, but it's looking at holistically. Everyone has an important role and part to play in ensuring that not only our children are well educated, but the workforce is supported with high quality early childhood education, and not just putting your children anywhere, but in spaces where our children are going to be supported, safe, and thrive.
Absolutely. It occurs to me that we need to think differently about who child care providers can be and open the opportunity. I heard about a wonderful program in Poughkeepsie this morning where they're going to people in neighborhoods, and especially women who have not seen themselves as professional child care providers, and giving them the training and the opportunity and the support and the guidance and the counseling and the opportunities to have real lived experience with children and bring that lived experience to provide wonderful nurturance and childcare to families who are so desperately in need. So we need to not just think about the regulations, the restrictions, the impediments, the staffing, but we need to think about who that staff is and who can be staff for some of the programs that we want to open and that we so desperately need. That can be the water to this desert that's existing now. Other thoughts as you think about childcare and as you think about this in an election year where childcare is not on the docket on many people's minds to discuss, how do we get it talked about at a national level so that it makes a difference?
Well, first of all, I'd like to meet the people in Poughkeepsie. That sounds like a fascinating program. And they're for Poughkeepsie. Okay, I'm Tulsa. Let's talk afterwards. See, the conference is working. So I think that's a fascinating insight about broadening while still obviously holding true to quality and but thinking more deeply about that, and that's a powerful lesson. it's true that it's not really on the agenda. It's also true that infants and toddlers and young children don't vote, and they're not contributing dollars to campaigns. So the issue does get ignored. However, what I've been taken by in the 15, 18 years I've worked at the George Kaiser Family Foundation, talking often, if not largely, to conservative legislators in Oklahoma and in D.C., that issues of birth to 3, infant, toddler, health and education and development resonates well. I always am frustrated that somehow we do not leverage that opportunity fully. I hear things that I get ambivalent about. People will say, well, we can innovate there because the unions are not strong. Okay, fine. That's a perspective of some conservatives of why they want to invest in early childhood. Or the wars that we're hearing in our school boards are actually not present in early childhood centers. I say these things to say there is room for consensus. Yes. On this issue. It's less divisive. And so I want to find better ways to reach into that opportunity.
Yeah. It's often been said that the most compelling way to execute change is to have a really good story to tell. And so for those of you in the audience that care deeply about childcare, you can help us by being our storytellers and having a compelling story to tell about how quality childcare changed the life of someone you know and care about. That's extraordinarily important and often the most persuasive way to get change started and to get a change movement started. I want to thank you all today. Anyone have one last thought they'd like to share with the audience?
My last thought would be that as we think about childcare, we've talked about the workforce, we've talked about the impact on families. We're here to talk about what's best for children. And I don't think anyone would disagree that when we create healthy, strong environments for children and families to thrive, we all benefit.
Absolutely. Thank you so much. Thank you to our panel. Keep doing the hard work and the heavy lifting.
Thank you.